dear doctors. Today I'm gonna discuss with you my blue sheet preparation. I took my Step 2 CS last year and I decided to share with you some tips to pass your exam successfully. So here's my exam report, and now we'll discuss blue sheet. Okay. So here is the general mnemonic for any pain that you will face on your exam. So you start always when you see doorway information, you always put 3 things on the right upper corner of your list, which is patient name, age, and chief complaint. Also, you'll see 4 parameters: temperature, blood pressure, heart rate, and respiratory rate. And you have to put only the parameter which is abnormal. For example, in this case, we see fever, and we write down the number. That's it. So the red is what you take from the doorway information. Then you begin preparing your note. So mnemonic is OSPDF, and the second part of it is LICRA plus minus. I highlighted part of this mnemonic with blue because the blue is the part which also you can use for any other complaint, not only pain. For example, if you have a cough case, you write down OSPDF, A plus minus. You don't have to write LICRA, complete LICRA. So let's discuss what those letters mean. OR is onset of pain. When did your pain start? S is for what patient himself think about the reason of his pain. So it's self thought. You can ask patient, I usually ask this way: do you know what might brought your pain on, or do you have any idea of what could cause your pain? Then progression, duration, and frequency. If your patient says that his pain is constant, that means that you don't have to ask him about frequency, you just skip this letter. And every time you think that the letter is unnecessary, you just skip it and go forward. So then the second part is LICRA plus minus. L is for location, I for intensity on the scale from 1 to 10, Q is for equality, R is for radiation, A associated symptoms, plus alleviating factors, and minus aggravating factors. If your patient says that he does not have radiation or any other components of this mnemonic, you just strike out like I did it here for radiation. Okay, so the easy way to ask about alleviating and aggravating factors is just to ask, does anything make your pain better or anything make it worse? Okay, that's it. After you did with this part, you use transitional phrase like, okay, I asked you, now I'm gonna ask you about your health in general, and then you ask questions for review of systems. Here is a VABUS, which is general mnemonic for review of systems, and here you can write down any other components of review of system and it must be very focused. We'll discuss this later. So, vabus, W is weight, A for appetite, B bowel movements, U urination, and S for sleep. Okay, let's say in this case we see patient with knee pain. Of course, we can skip sleep. We don't have to ask all those components all our patients. And before entering the room, for this case, you also can add information like this: rash, redness, swelling, warmth to touch, and tingling, numbness, and weakness. Okay? Then we move to lower left quadrant of our blue sheet, which is PAM hist fuzz. P is for any previous episodes of similar complaint. So P is previous. A is allergy. M is medications, both prescribed and over-the-counter medications. Hist. H for hospitalizations. Have you ever been hospitalized in the past? I for any other illnesses. S for surgery, and T for trauma. And the third part is FUS. F is family history. O is OB-GYN. It's only for female cases. Of course, you skip it in cases when you face male patient. First S is for sexual history, and second S is for social history, where you have to ask about cigarettes, alcohol, and drugs, recreational drugs. Sometimes you don't have to ask all those three components. For example, if you face patient with let's say bleeding, or like in this case knee pain, you can skip some components. And after you ask about CAD, you can make counseling, but sometimes again you can skip it. For example, you have patient with acute chest pain, and you think it's life-threatening. Of course, you don't waste your time on counseling. Okay, that's it, guys. Hope it helped you on your exam.